Hello friends, welcome. Today, we are going to discuss a very serious topic, Alzheimer's disease. As the scientific world discovers more about this disease, it is even more important to understand how our lifestyle and daily habits can affect our risk of Alzheimer's. First, what is Alzheimer's disease? Alzheimer's is a type of dementia that usually occurs with age, causing the loss of nerve cells in the brain over time and disruption of their connections. However, today we know more about the factors that play a role in the development of this disease and have discovered that certain habits can increase the risk of Alzheimer's. Did you know that irregular sleep habits can increase the risk of Alzheimer's? Sleep plays a critical role in clearing toxins from the brain. It is thought that irregular sleep habits may interfere with this clearing process, leading to toxins accumulated in the brain that can lead to Alzheimer's. However, the impact of physical activity levels on Alzheimer's risk should not be underestimated. Regular exercise increases blood circulation, improves oxygenation of brain cells, and supports the health of nerve cells. Research shows that individuals who exercise regularly have a lower risk of Alzheimer's. The positive impact of social interactions on brain health is also undeniable. Staying socially active strengthens neural connections in the brain, preserves cognitive functions, and may reduce the risk of Alzheimer's. Therefore, regularly spending time with friends or attending social events can be a protective factor against Alzheimer's. Eating habits can also affect the risk of Alzheimer's. An unhealthy diet can interfere with the intake of nutrients that are essential for body and brain health. Adopting a diet that includes nutrients important for brain health, such as omega-3 fatty acids, can reduce the risk of Alzheimer's. Finally, we should emphasize the impact of lack of mental activity on the development of Alzheimer's. The brain can become weakened when it is not used. Therefore, doing mentally challenging activities, learning, and staying mentally active are extremely important to maintain brain health. Remember, each of these habits can increase the risk of Alzheimer's. However, we now have the chance to change these habits and adopt a healthier lifestyle. Starting with small steps, we can reduce our risk of Alzheimer's and protect our brain health. What are Alzheimer's treatment methods? Alzheimer's disease affects the family as much as it affects the person herself. Therefore, before the treatment process, the physician informs the patient's family about how to treat the patient, what to do, and what not to do. There is not yet a treatment to completely eliminate Alzheimer's disease from the body. Current treatment methods can only slow down the progression of the disease. With this feature, it is also aimed to reduce the patient's complaints. Alzheimer's treatment varies according to the current state of the disease. Treatment with medication is usually started at a low dose. As time passes, the dose of medication is increased. Thus, the quality of life of both the patient and the family caring for the patient improves. Despite all this, the patient deteriorates over time due to the progressive nature of Alzheimer's disease. The person has difficulty in doing his/her daily chores. In this process, the patient should be cared for in his/her own environment. In other words, if the patient does not live with his/her family, the patient should not be cared for in weekly shifts from one home to another. Instead, it is important for the patient's comfort and mental health to stay at home and care for the patient.